Welcome to Prepared for Parenthood, the podcast for hopeful, expectant, and new parents with little ones up to age 5. I'm your host, Dr. Stephanie Duger, a psychotherapist, author, educator, parent coach, and married mother of 2. On this show, we'll discuss everything from the most up-to-date practicals of best supporting your young children, to thriving in relationship as a family, to more surprising topics around the psychology and development of babies from conception through age 5. So sit back, relax, and enjoy. I'm thrilled to have you here today. Welcome back to Prepared for Parenthood. I'm so excited to introduce our next guest, Dr. Christiana Rebelle, who is a perinatal health consultant and researcher dedicated to educating medical professionals to enhance health literacy and communication between parents and providers. With 20 years of experience, she has served as a health coach for pregnant women and new mothers, written extensively on perinatal health, and conducted seminars and workshops in her community. She's currently also the editor-in-chief of the Journal of Prenatal and Perinatal Psychology and Health. On weekends, Christiana enjoys outdoor activities with her wife and 3 young children. So happy to have you on, Christiana. And I'm wondering if we could just start by just sharing a little bit about your background.
My career started out in a combination of military service, fitness, and nutrition. It wasn't geared towards pre and postnatal psychology at all in the beginning. Now, with late teens, early 20s, I had a passion for health and I wanted to be helpful. And I thought that was the logical way to go. So I went off to boot camp a couple days after my 18th birthday. I came back and got my personal trainer certification. I was all motivated and ready to go. And then my first semester in college, I was 19 years old. And my mom got diagnosed with metastatic skin cancer, melanoma. And a couple months later, she was gone. And you can imagine the rug was pulled out from under my life. We were both vegetarian, active. I was raised to be outdoors and we rode bikes everywhere. And she was this vibrant 52-year-old woman who just kind of, like most moms, had a pattern of not really looking at her own needs. And she was a single mom, raised 3 kids. It just really made me start thinking about what is health really? This woman who was just picture perfect of health, but she didn't have that kind of self-awareness of her own deeper health. It was all kind of surface level health, if that makes sense. And I was part of this fitness industry. It was all kind of about the superficial health. I no longer felt comfortable with it, and I would go to the gym that I started working at and where are the moms? Where are the pregnant people? Where is he? It just really started making me question all of it. And the fitness industry was having me push all these supplements and these things that I was just kind of, is this really science-based? I just shifted everything for me. And the rest is history. The last 20 years, I've dedicated to focusing on moms way before I was one. And that started out in the fitness industry. I started a company called Total Mommy Fitness. It took a lot of different twists and turns. Started out as just me being a personal trainer and nutritional coach and support for pregnant women. And I did some training in the gym, but then realized a lot of moms just can't come to the gym. They have kids at home or they're not comfortable or they can't afford it or whatever. So I switched to in-home training. And then I started a digital app and magazine that was more for kind of education. And then I created a personal trainer certification specific for trainers who wanted to work with pregnant women. And then I realized that the demographic I was serving was mainly white and people who could afford a personal trainer. And I was like, you know what? This doesn't feel good either. And so I went back to get my PhD and my dissertation was on beliefs and behaviors around physical activity during pregnancy among women in the South. Because the South, as you probably know, has the biggest health disparities and negative outcomes for women and children. And then the effect of provider counseling on those beliefs and behaviors. Because I really wanted to switch to healthcare, not just the women who can afford it, but the women who need it. And what are they being taught and how are they being supported? And then as a stay-at-home mom of 3 kids under 7 and a military wife, I can't be as hands-on as I'd like. The Journal of Prenatal and Perinatal Psychology and Health, I'm the editor-in-chief of that and trying to do more education and outreach.
So when you were doing your dissertation research, what were some of the inequities that you saw for people who are pregnant, specifically in healthcare?
My research ended up taking a lot longer than it should have because I ended up going down all these rabbit holes of, oh my gosh, I didn't even know this was a thing. And oh my gosh, how can the history of gynecology of Black women in healthcare, why isn't this common knowledge? And I think it is becoming more common knowledge, but still there's so much about the history of gynecology, obstetrics and slavery and eugenics, the history of healthcare in this country, particularly in the South, is abhorrent. And there's ripple effects now in the South, particularly. Most of the births are still very segregated. You have the Black kind of less funded, less resources available. And then you have the kind of white hospitals that are more funded and more resources available. And the outcomes, regardless of income, health, are completely different. So it's really sad. And most births, I wish I still knew the statistics. It's been a few years since I did this research, are still covered by Medicaid for Black women in the South. And so, as you can imagine, the quality of healthcare they get is much worse than the quality of healthcare of white women. So there's major divides based on just Black and white.
Sure. So I want to loop back to this later in our conversation, hopefully, but also you talked some about the gut microbiome and the impact that that has on our health and our baby's health. And I'm curious for anybody who doesn't know what gut microbiome is and why it's so important, if you could share a little bit about what you know about that.
Yeah, this is fascinating because I've been interested in nutrition and health since I was young and really devoured every book or class. I just had this kind of insatiable interest in the human body. And I didn't learn about the gut microbiome and any of that. I've really only learned about it in the last few years. It's this really fundamental part of our health that people are just kind of learning about. And I'm glad because it needs to be known. But the synopsis version of the gut microbiome is basically we all have a lot of bugs in our tummy. That's how I explain it to my 3-year-old. And he's always like, my bugs are full. I can't eat anymore. We always talk about his bugs. Anyway, there's billions, if not trillions of microbes in our gut. And they basically control just about everything to do with our health, from the psychological to the physical. There's a lot of people who have what's called gut dysbiosis. And basically, it's just an imbalance of those bugs. They have not enough of the good ones and too many of the bad ones. And the blueprint for the diversity and amount of those good bugs is at birth. And again, going back to the health inequities, cesarean section and interventions are much higher among lower income Black women, people who have Medicaid births or aren't privileged. I don't know how to word it without sounding offensive. It's just unfortunately backed by data. The more interventions you have during birth, the less healthy your gut microbiome. And a lot of times those infants are then given antibiotics post-birth, which then kill off any of the good bugs they did have. And so to really set a healthy blueprint for your gut, the best way is an unmedicated vaginal birth with skin-to-skin contact immediately after breastfeeding and not cleaning up the baby, not cleaning up the mom, just letting all those natural microbes get into the baby system and creating that kind of symbiotic relationship between the parent and child.
So interesting what we're still learning, right? If it impacts all of your aspects of health, what is the challenge for a little one who has lots of interventions and maybe doesn't have quite the diversity of gut microbes that might be optimal? What can happen?
Yeah, I'm glad you asked that because it's interesting. So we have 3 kids. I carried the first and the last, and my wife carried the middle. And the middle one, he got all tangled up in the cord and had to be an emergency C-section. Then he had health issues afterwards. They gave him months of antibiotics, much to my dismay. So he was an emergency C-section followed by antibiotics. My wife is a physician. She would say correlation isn't causation, but to me, he is by far had the most health problems. He has all kinds of breathing and asthma issues and chronic ear infections. He gets sick more than the other ones. And it's just hard to see the difference because it almost feels like as a mother, oh, we failed you. I did such a disservice, but you do the best you can with what you have. And what we did and the best you can do in that situation is breastfeed as long as possible because breastfeeding introduces healthy microbes. Also, he was a COVID baby. So we were on lockdown in Hawaii. We didn't have a lot of opportunity to kind of go out and get exposed to these different bugs when he was young. He wasn't out exploring and putting things in his mouth like little babies. Letting your kid go out and eat dirt, not in a highly fertilized or pesticide area, but letting them be in symbiosis with nature as much as possible because there's microbes all around us and we're part of that ecosystem. Having a dog helps, and then probiotic supplements can help, but they don't really colonize the gut. And then prebiotics are like the fiber from fruits and vegetables that the bugs eat. So healthy food is basically fuel for your microbes.
So what kind of specific advice would you give to expectant parents about how to best stay healthy in terms of nutrition and fitness?
First, I would say ignore everyone because everyone has a comment about what you should be doing or shouldn't be doing. It can get very confusing and frustrating. And there's a lot of research that I shared in my study and my dissertation and confirmed in my own research that women do not receive support. They receive more obstacles for staying healthy and active and exercising and eating well during pregnancy than they do support. And it's a shame. But there's so many old stereotypes about what it means to be pregnant. And it usually means kick your feet up and be an incubator for 9 months. When basically the research over and over and over the last 3+ decades, there's been extensive research in it. And basically the more active you are up to a vigorous level, it's not just like walking, don't break a sweat, like up to a vigorous level, the more active you are, the healthier you are long-term, not just for your pregnancy. The less interventions you need, the healthier your baby will be intergenerationally. So like not just them, but their offspring from evolution. We are a product of our grandparents and great-grandparents. So these effects are intergenerational. So you have the opportunity to really shape the trajectory of your family health just by what you do during pregnancy, which also puts a lot of pressure on moms. And I'm aware of that. It's like, oh, great, one more thing to do. But going back to your question, whatever you can do, whenever you can do it, as consistently as you can do it. With my first, I was incredibly sick from day one. All I could keep down was Cinnamon Toast Crunch. I was devastated because I had this idea of eating healthy and exercise, and I had to be okay with just what I could do. And some days napping was priority, and other days a walk was priority. And on a day I felt good, maybe I would do some body weight exercises with just like a stability ball and a band. And then as my pregnancy progressed, I was able to do more things. But because I had kind of maintained some base level of a habit and fitness, I was able to kind of jump back in and could kind of feel the effects of not just giving up and not doing anything. Stick to the basics, body weight. If you have a gym membership and can get a trainer, great, but most people can't. And so doing what you can when you can, even if it's 10 body weight squats and some push-ups against the walls, like those big muscle groups, full body. Don't really worry too much about those inner thighs and biceps. It's not a time to work on the vanity muscles. Really focus on what's the most bang for my buck? What's going to get my heart rate elevated? What's going to work those large muscle groups? And that can be a simple kind of 3 exercise routine a couple times a week or daily. The official recommendation is 150 minutes. So that equals 20 to 30 minutes a day. But if you can't get a day, just add that to the next day. So it's cumulative. You can do a couple days a week. It's better than nothing, but daily is best. And then nutrition wise, eat more vegetables, drink more water, eat less processed food, get back to the basics. Don't overthink it.
For everyone, right? Was your experience with your second child that you carried, your third child together, was that similar? Were you very sick at the beginning, or was it a different experience?
So with both pregnancies, I found out I was pregnant really early on, like a week, like, I don't know, I say a week. It might have been a little bit longer. By gagging when I brushed my teeth, just so nauseous. And then I took a pregnancy test and there was a faint line and I got darker over time. The second baby, I actually tested positive for COVID at the same time I tested positive for being pregnant. So I was like sicker than sick. And that was rough and scary because then I went down the rabbit hole of research of like the effects of placental development when COVID, and there can be some real issues with that. And luckily he came out healthy and fine.
Glad everything went well.
The second one, it surprisingly, or maybe not, was much easier. I think maybe my body knew what to do. I knew what to do. I recovered faster. My oldest, she'll be 7 in July, and then the youngest just turned 1 in February. I was 35 for the first one, and then almost 41 the second.
That's great. So in that same vein of you having a family with your wife, how long have you two been married?
Since 2016.
And you said that she is a physician and she's in the military.
She's a surgical oncologist at the Army base here where we're stationed.
Can you share a little bit just around your journey? Did you meet in the military?
I got out of the military because I didn't want them telling me what to do with my life. And then I met someone in the military. I'm like, I should have just stayed in and got paid for it because now they're telling me what to do with my life. And I don't get the benefits. But no, we met in Texas. I was in Austin. She was in San Antonio. And because I was an entrepreneur, I was much more mobile than she was. So I moved to San Antonio, and then we got stationed in Hawaii, and then to California for a couple of years for her fellowship, and now back in Hawaii for 4 years. The interesting thing that I think is most relevant to this conversation is military medicine is such, like, I'm assigned to an obstetrician, but I see who's ever there. So I saw nurse practitioners, I saw doctors, I saw midwives. Throughout both of our pregnancies, we saw dozens of different healthcare providers. And because I was going through my PhD and, I have this background, I asked every single one of them about health, not because I didn't know, but because I wanted to know what they knew. And unfortunately, I can report not one of them gave me correct guidance. And most of them framed it in the negative. So, for example, what can I do to exercise while I'm pregnant? It would be, don't overdo it. It wouldn't be an encouraging, oh, I'm glad you asked. It's really good for you. Here's the guidance. Another one would be, if you were a runner, stop running. Like, that's not a thing. If you're a runner, you can keep running. The guidance would be, if you weren't running, you probably shouldn't take up a marathon. It was really unfortunate. And even my OB, who on my second pregnancy, he sat down and he tried to counsel me on physical activity of his own, I didn't even ask. He just did like a 20-minute counseling session on physical activity. And I was cringing through most of it. Like, I know you mean well, but your information is so outdated. And I didn't say this. I just kind of listened and nodded and appreciated the effort. But later on, a couple appointments later, kind of told him, like, hey, do you mind if we talk about some of the guidance you gave me? And this is really important because one of the assumptions is if you get your heart rate elevated, it takes blood away from the placenta and the fetus. And this is something that is assumed to be fact. You've probably heard, don't get your heart rate above 140, completely arbitrary, not based on any research, but it is an accepted guideline. If you actually read the research that's been done on this, it is fascinating because while it's true, there's a temporary kind of hug of blood and oxygen and resources to the muscles you're using. So say you're running, your blood's going to the leg muscle. Say you're lifting weights, the blood's going to that muscle, right? So it's taking it away. But what happens when that muscle relaxes or you take a break? There is a rush of nutrient-rich blood and oxygen to the placenta. So it's this fighting for resources that actually strengthens the placenta and improves the developing baby's health, blood flow, oxygen, brain development, because it's getting these rushes of blood and oxygen that it wouldn't get if you were just staying in that kind of level, low heart rate zone that's encouraged erroneously. So it's unfortunate because the benefits are so, so, so great. And cardiovascular disease is the number one killer of women. Most maternal morbidity and mortality, like 85% of it, is preventable. And these really basic things that are within our control are not only not being taught and shared, the opposite is, which is why I get so fired up about it, because it seems like such low-hanging fruit. If we could just get past the old way of doing things and move into 24? This research has been around since the 80s. Let's catch up.
Yeah. And speaking of the slowness of systemic change, there's the health and fitness, there's focus on pregnancy and postpartum and how it affects people who have given birth and different socioeconomic classes,
Mhm.
ethnic disparities, and all of that. And I'm wondering if you could share a little bit. I know you're part of the cultural inclusion
Mhm.
committee, the Association of Perinatal Psychology and Health, otherwise known as APA, as well as their editor in chief of their journal. How are you working together to create greater awareness and inclusion, underrepresented information as well
Yeah.
as peoples?
The priority has been actively seeking out topics and authors who are part of and speaking to this topic. So the Policy Center for Maternal Mental Health has agreed to be an ongoing contributor. And the last journal, they contributed an incredible article about maternal suicide. Unfortunately, that is one of the leading causes of maternal mortality in this country. And, I want to just pause because I talk so much about fitness and nutrition and health and stuff. It is so important to recognize the psychological component because a proven way to mitigate mental health issues during pregnancy and after is through fitness and nutrition. Like, we're not just talking about bouncing back after pregnancy. This literally has short-term and lasting effects on the mother and child's mental health, because we know if the mother has, say, prenatal anxiety and postpartum depression, that has lasting mental health effects and developmental effects on the child. So what I love about this journal and the organization is that it's psychology and health. We're not just talking about physical fitness or mental health. We're talking about how they interrelate. And that has been the direction I really have tried to take the journal. And I'm actively working on finding ways that we can talk not just about psychology, which is the origin, but how it plays out in real life for real people in this upcoming issue. I'm republishing my study, not just to, show off, but because I think it's so important that it's disseminated as widely as possible. Underserved people in this country, especially in the South, families are really suffering, and the effects are real and lasting and intergenerational. One thing I forgot to say about my research is that I found that provider counseling, which kind of echoes what I found in my anecdotal experience, provider counseling had no effect on behavior regarding physical activities. So women who were counseled were actually slightly more sedentary. So they were women who were counseled on physical activity were actually slightly less active than who were. And Black women and high BMI, body mass index, were indicators of less physical activity and more sedentary behavior. And white women who exercised previously, because white women usually have more resources, more access. It's more culturally not just accepted, but expected that white women exercise. But it's not as supported in Black communities. And the research showed that.
And was that true even when the health providers were from similar backgrounds, or were the health providers from different?
So, interesting question. So the question on the survey was, were you counseled on physical activity during your pregnancy? And about half of them said yes. And the socio-demographic of the sample were representative of the demographics of the South. So we had the same percentage of white respondents that represents the South, same percentage of Black respondents, Hispanic, Asian, and so forth, and socioeconomic. So we got a representative sample of the population, but we did not get the demographics of the providers. But you can assume that those providers were counseling the women from that demographic.
Do you mind if we come back to a more personal, in your experience of being a parent, having a wife who's still in the military, have you experienced any challenges in your family? I don't know if your wife gets deployed or how that works, if you're a physician. And then just your experience, like any systemic challenges that you faced or just personal challenges that you faced in having a family together?
Oh, certainly. Military life is not easy. My wife's grandparents are in Florida, and then Florida to Hawaii is a very long trip. So we don't get to see them very often, which also means we don't have support. So I'm working from home and 3 kids, and it's tough. She went to Afghanistan and was embedded with the special forces before we evacuated. And it was incredibly difficult. I didn't realize how difficult it would be because it's not just like, oh, she's fine, she'll be back in 6 months. It's like, oh, she's in a war zone and there's incoming bombs that they're having to intercept. And there was a 12-hour time difference. And so basically she would be waking up as we were going to bed and vice versa. And so finding time and also finding connectivity to be able to FaceTime and finding a safe place where she could go outside to get a signal, but also stay safe. I had to seek mental health help because I didn't want to get out of bed. Like I was just paralyzed by fear. And I had a 1.5-year-old at home who was having behavioral issues because mama was gone and that was causing emotions that she didn't really know how to express. And I was having a kind of mental health reaction to it. So I don't think I was as maybe present or patient as I could have been. And so she was hitting and biting and doing those kind of typical, I don't have the words to express my feelings, so they're going to come out. She actually sent me to the urgent care. I was buckling in her car seat and she poked me in the eye. And I had a double corneal scratch. I had double vision and like tears coming out. And I was trying to drive myself to the hospital. And they said, yeah, there's a 50-50 chance you'll lose your vision. And yeah, luckily it healed. But yeah, poor thing. We were both struggling so much.
Did you just have the one at this point?
Yeah,
or-
I can't imagine.
Yeah.
Yeah, she's probably going to have to go again this year, not to Afghanistan, to somewhere else. And now we have 3, but the middle child is very attached to her and struggles with how much she works. Her job keeps her away a lot. And it's been an ongoing struggle since he was born. Like mama's boy. He wants mama. Like, I'm okay, but not his first choice. Yeah.
And I imagine this is pretty common with military families. If one parent is being deployed and the other parent is home with child or children, there must be a lot of extra challenges a parent has got, especially for months at a time.
Yeah.
How hard that must be for everyone involved, but that child and the parent at home and parent who's away, missing the family.
And then coming home and having to integrate too, because they get in that kind of survival mindset and very detached and disconnected. That can be tough. And I know you know a lot about early childhood development and attachment. And think about those attachment disruptions of all these families. There's so many families where the parent isn't there for the birth. The parent misses the first year. And that's been going on since probably the beginning of time. These soldiers who miss so much and maybe they come back with PTSD. People don't realize how disruptive military life is on families and children.
Does the military have, I know they have resources specifically for veterans with PTSD. Is there support for the greater family?
In theory, there is. How accessible it is and the consistency of the quality. Sometimes it can be hard just to navigate the healthcare system. And you also have to be careful with what goes on your records. Like I'll just give a quick example. Because I sought mental health care while my wife was gone, I had a diagnosis then on my file. And my wife couldn't get orders to our next station, which means we couldn't get housing. You need orders to schedule movers. She couldn't get orders because I had to go through this, what's called ESMP, Exceptional Family Member Program, where basically you have to get a lot of extra paperwork and red tape and assessments to assess your special needs before they can sign off on your next location. I mean, it's crazy. So because I was proactive and I'm like, hey, I'm really struggling here. I need help. It basically messed us up because on the way back to Hawaii, I am labeled, we couldn't get orders again until last minute. So then we couldn't get base housing. So then we had to get off base housing because you have to have orders to get on the waiting list for base housing. So there's a lot of people who don't get help, especially service members, because it negatively impacts your career. It holds up orders. It can prevent you being promoted because you're kind of like flagged as someone who has this mental disability,
It's such a conundrum because we want people to seek help, right? And we encourage people to do that. And then when they're not able to because of the flagging and the red tape that you have to go through, that's
Yeah. And my kids really struggled with the transition from Hawaii to California because they were so young when they were in Hawaii. My daughter was born in Texas, so she doesn't remember it. And so Hawaii was all they knew. And then they went to California and they really, really struggled. But then they got used to California by the 18 months later. And then we were only there for 2 years. So they really hit a groove in the last 6 to 8 months. And then we uprooted them and came back. And so this time I was proactive, and they share a military provided counselor that they adore, and they take turns going once a week. And it's just someone that they can talk to. They're only 3 and 6, so they don't get too deep, but talk about the transition, talk about mommy and mama, talk about their relationship with their sibling, the transition. It's been such a blessing. So I don't want to talk all negative. They do have stuff out there. It just can be hard to find the right fit that doesn't bite you later.
And just to piggyback on that, have you experienced any challenges with your specific family? So the two of you being married, the two of you having children, has there been any challenge around that piece of just insensitivity or cluelessness or
Oh, yeah.
however you want to put it? I'm so curious, I'm, hetero cisgender and I have my own world, right? And I'm sure I've put my foot in my mouth at times. Would love to hear anything that you would feel open to sharing about what your family
Yeah.
has been like in that aspect.
A couple things jump out. First of all, I am an open book, but people ask questions that are very crass and blunt and intrusive that you would not ask someone else, or they make assumptions based on what little knowledge they have about our situation. As far as the systemic kind of healthcare piece, interestingly, when my wife joined the military, it was under don't ask, don't tell, before gay marriage was legalized. So she had to be in the closet in the beginning of her career. And there's certain doctors that she works with that she knows she cannot be open about who she is because it will negatively impact, say, their review of her when she was in training and had to get their approval. There's a lot that she deals with navigating that. Being a surgeon, a female surgeon, a gay surgeon in the military, there's a lot that she deals with. On my side of things, I found it interesting that when we were trying to conceive, we have a known donor. So our donor is the godparent of our children, like extended family. And because it was considered elective, the insurance didn't cover, like if we wanted to do intrauterine procedure or IVF or something, because it was considered elective, it wasn't covered, which is funny. It's not really elective because I literally can't get pregnant with my spouse. So that may have changed since 2017 when we first had our child, but we chose to do a home procedure anyway because my wife's in physician and donors significant other is a physician. So we had two physicians in the mix. Anyway, then fast forward to my third child and my doctor, who seemed very progressive. He's the one that tried to counsel me on physical activity and nutrition. He asked with a straight face if I used a turkey baster to get pregnant. And I was like, we did insemination using medical grade equipment. And I corrected him very, politely, kind of like, it's not really called that, and he laughed it off. It's like, oh, whatever, you know what I mean. I'm like, yeah, I know what you mean, but I'm telling you, it's not okay. Like maybe it is for some people. We'll joke to our friends or whatever. It's kind of a stereotypical joke, but it's one thing if we say it, it's not okay for a medical professional to use that kind of slang, It was just offensive.
In which so many people using artificial reproductive technology in general.
Yeah.
I would hope that health professionals were keeping up with
Know
what's
the language.
appropriate.
Yeah. It was disappointing, because it's kind of like, don't minimize the options I had available to me.
Pregnancy and gestation and birth are still such a miracle. Like that, I still so blown away by just putting a seed into the ground and watering it and having some sun and watching
sprout.
it. Yeah, like it's just fascinating to me that we reproduce at all, right?
Mhm.
And so to celebrate that for everyone, no matter
Yeah.
how they came to be where they're at. I just feel like it's so important. It's sacred ground, no matter how
Yeah.
we get there.
If you're interested, the method that we used, we got pregnant the first time with 3 kids. And we've had friends who were struggling to get pregnant, heterosexual friends. And we told them what we did, and they got pregnant. So I feel like I've kind of stumbled onto this, like, not that it's going to work for everyone, but we came
Would you
across a
be
really
open to
simple way.
sharing that?
Yeah.
So
So,
people would love to hear this.
yeah. Okay. So we used just an app and tracked our cycle. The first time I tracked it for like a year because I planned so much. And I knew almost to the minute when I was going to ovulate. And I was lucky to be pretty regular. My wife has PCOS. And so she had to get an injection to make herself ovulate. But anyway, so once you figure out when you're ovulating, and we went online on Amazon and got these little strips that you basically pee in a cup and dip it. And then if there's a line, you have the
HCG.
Yeah, okay. If you had that hormone, it means that there's about to be an egg. And so, as you probably know, sperm can live inside the body for up to a few days. And so we did it right away. As soon as we had that line, we did it in a very early window. And then what we did was, again, on Amazon, got disposable speculums, like what the OBs use to kind of open to see your cervix, and a syringe. So our donor did a live sample in a sterile specimen cup. We then poured it into the syringe with the butt raised on a pillow, put it into the speculum directly on the cervix. Like you can see the cervix and put it directly on the cervix. Then took it out very carefully so the sample doesn't come out. And then, those flex discs, I'm not sure if you've seen them. They're like disposable, almost like menstrual cups, almost kind of diaphragm looking caps, right? So basically, you put the cap in, you leave your butt raised. And then if you can, and I'm not sure if this is a G-rated podcast, then if you can, you have an orgasm because you want to stimulate all of those muscles contracting and kind of getting the sperm to where it needs to go. Basically, help the little guys along. And then you stay there. So pee before, so then you don't have to get there. So do it overnight. So you do it before you go to bed. Stay with your butt up on the pillow with the cap
All
in.
night.
And as long as you can. I think my wife had to get up and pee. But honestly, it probably doesn't have to be all night as long as you wait long enough for the little guys to get to where they need to go. We had a couple heterosexual couples who did this without the speculum. They just had, intercourse, put the cap on, butt on a pillow, didn't get up, whatever they needed to do to orgasm, and got pregnant after like 6 months of trying. So there's something about it's there, it's held against, and then the stimulation. And then also, I know you're familiar with prenatal bonding. We did this is a safe and loving place for you. You're wanted, welcoming them into the world. And it worked.
And you did this just 3 times and only once per kid. So it worked every single time.
Yeah.
And then when do you take the cap out? Do you have to wait 3 days to take the cap out?
No, I'm so glad you asked that because we did it multiple times. But I'll tell you, I think it worked the first time. Like I'm really in tune, and my wife's not quite as in tune, but I kind of told her my experience, and she's like, I think I felt that same thing. Like I just knew when the sperm found the egg. I just felt it, the next day. So the next morning you get up and, I don't know, pee, shower, whatever you want to do, clean yourself up, and you can throw it away. And then the next time you try, say, the next 2 days. And then also we had our donor store up a few days the first time. So there was as much as possible in that first sample.
Amazing. Thank you so much for sharing that.
Yeah, sure. And sperm is
I'm
made of few
hoping
months.
that it helps
So
people.
sorry.
Yeah.
Sperm is made a few months in advance. So if your partner or your donor is, make sure that they are also eating healthy and not smoking and whatever. People think that sperm is just this kind of like
daily thing.
Yeah, but it's not. It gets made a few months in advance and then stored. And then while the new ones are being made, it's a cycle. So male health is important too.
Well, it's been an absolute pleasure speaking with you, Christiana. Thank you so much for being here. And I've just learned so much and so appreciate you sharing.
Thank you for letting me talk about all this. I love it. And I really appreciate your time, and I'm excited to listen to all your other podcast episodes, and I'm sure I'll learn a lot too.
Thanks so much.
Thank you so much for listening to the Prepared for Parenthood podcast today. I hope you found this episode educational, informational, and conversational, and that you'll join me again for another episode soon. If you enjoyed listening to today's podcast, I'd very much appreciate if you would rate, review, and subscribe. If you're interested in more information related to today's podcast, or are looking for parent coaching or courses, you can find my information in the show notes or online at preparedforparenthood.com.